So why don't we get started? The agenda is really loose on this one. I've got a couple of graphics up here that are relevant in different ways. The $100 trillion bill is really talking about this Institute for Healthcare Improvement initiative that's ongoing right at the minute called the $1 trillion checkbook. And I'd recommend that you take a look at that. It's quite an impressive piece of work that they've just started to launch and to gather behind, with the idea being that there's about $1 trillion a year worth of waste in the US healthcare system, and they've put out a call to action to eliminate 50% of that within the next 5 years. And obviously that's a massive endeavor. And part of what they're talking about is various different combinations of tool sets to be able to help to do that. One of which is obviously PDSA and some of the more advanced techniques of problem solving. So today is just going to talk about PDSA, and we're going to go through a few examples. We're going to talk at some problems that waste causes. We're going to talk specifically about some of the problem categories and methods of solving problems, and eventually lead that into PDSA itself, and then summarize and wrap up. And as I said, if you have examples that you want to bring up at any point, by all means do that. We've got quite a few from our own archives, but we're always interested in new ones, especially when they're relevant to individuals. And if there is a way that we can help you to get extra value from the webinar, we'll certainly do that as we can. So let's dive into this a second. So Brianna, I'm not sure of your background with this, but just as a really quick overview, we're talking about something that is almost 70 years old at this point, the PDSA cycle. W. Edwards Deming designed what we called the Deming cycle, originally from Walter Shewhart, his mentor's Shewhart cycle back in the 1930s and 40s. And then, of course, Deming was invited over to Japan to talk to the Union of Japanese Scientists of Engineers, or JUSE. And they then took that concept and refined it into what they called the PDCA cycle, the Plan, Do, Check Act. And check was really meant to be an evaluation at a specific point. Study was when it started to expand a little bit more. But PDCA was very well documented at that point, and of course the rest is history. The Japanese started to take that and develop not just an inherent problem-solving capability, but also develop that into what became the Toyota production system. There were more advanced versions of this, with eventually resulting in things like DMAIC, or the Define, Measure, Analyze, Improve, and Control methodology, which is the backbone of Six Sigma. That evolved in the sort of 1970-1990 timeframe. Around the early 2000s, IHI adopted PDSA as a standard problem-solving methodology. Not just in the United States, around the world, it started to become much more popular around that time frame. And it's arguably one of the predominant problem-solving methodologies in use in healthcare worldwide at this point. And there's a lot of good reasons for that, and we'll go through some of those as we dive through the presentation. So PDSA is all about problems, and as you know, with working in healthcare, problems exist everywhere. There's almost no endeavor within healthcare where there aren't some problems or other that are causing difficulties, and they manifest in different ways. A lot of them, though, eventually end up manifesting as wasted time. And with empirical evidence, and certainly my experience and a lot of others that I correspond with, there's this sort of rule of thumb of about 30% of time in any given process in healthcare of being wasted. The variation is massive. It can be anything from 5% through to 90%, and I've seen both ends of that spectrum. But usually, as a good rule of thumb, you can start off with 30 and start to refine it from there. 30% is still a massive amount of time wasted. And that time it's important to understand that it's not just the time. The time is quite often a symptom of a particular set of root causes that are manifesting as waste. So it's a great indicator. One of the things that I always talk about is, especially in a hospital environment, is from the patient's standpoint, one of the overall metrics that make an awful lot of sense is the length of stay, because almost all of the waste activities that happen lengthen that length of stay. And the way that patients move through a hospital, the length of stay represents capacity in that hospital system that is being consumed at any one point. Now, it follows that if you can reduce that length of stay, you can reduce the amount of capacity that's being utilized, and that capacity then becomes available for other activities, other patients, whatever it may be. And that's got ramifications when you start talking about a current situation where you've got baby boomers that are going through the aging process and becoming sicker. You've got doctors and nurses that are either retiring or leaving the system. And so there's strains on the overall system in terms of increased demand and reduced capacity. Shine a very bright spotlight on this particular activity. Anything that you can do to be able to reclaim that capacity is a good thing. So here's a quick question for you. How many problems do you deal with every working day? And how much time do you estimate you spend working on or around problems in every working day? I'm going to give you about 30 seconds to respond to that in the chat box. So if there's, if you would care to let us know any of those, so we'd certainly appreciate it, and we can start to get some idea of what we're dealing with. So that's about 60 individual problems. Is that the amount of time in the working day, or both? Problems, yeah. And that's about, I'm not going to say normal, because obviously the variation is massive, but it's rare that anybody has less than 5 or so, and it's rare also that anybody has more than 100 or so. But 60s are around about there in the ballpark. I'm not sure if Brianna's still with us, but I'd be interested to see if we're even in the same ballpark there. Safely say about 35, absolutely. But that's 35 individual problems and 60 individual problems, each one of which takes some time to be able to resolve. And quite often, if you like, most of the other people that I've ever worked with, that resolution is an individual, what we call a point solution, where you're resolving a specific instance of a problem which may or may not recur. So when you add all of that up, you can really start to get a significant amount of time that's invested in these issues. If you've got an 8-hour day, 480 minutes, if you've got 35 different problems, each one of which takes a couple of minutes on average to solve, you've got about 70 minutes worth there, which in terms of that particular day, it's well over an hour. So if you could make inroads to even reclaim half of that, and you could get an extra half hour back per day of capacity in your own individual sphere of operation, that tends to be worth something. So that's one of the things that we can talk about and be able to help to at least guide some thought processes around being able to focus on that. So thank you for participating in that. I appreciate it. About 35 and about 60. Again, you're right there in the ballpark. Most people are around that sort of a level. So let's take a look at individual problem types then. I don't know if you can see, Brianna, but there's a book that I refer to an awful lot, which is The 4 Types of Problems by Art Smalley. It's published by the Lean Enterprise Institute out of Cambridge, Mass. And what this does, it does a great job of identifying different kinds of problems and the specific kind of strategies that you can use to be able to deal with them. And one of those is what they call a just do it, which is really just basic troubleshooting. And I suspect that a lot of the issues that you deal with day to day fall into this kind of category. It's a simple fix. It's You identify the problem, and the solution is 9 times out of 10 relatively obvious. So you just do it. You just fix it. Multiple different examples that you can think about, but it's usually quick, and it's something that you can achieve very, very fast. But it doesn't necessarily resolve anything in a systematic way. That being said, it's very valuable, and there's perfectly reasonable opportunities and reasons for being able to use that particular technique. So the question becomes really, how often do you work with just do it solutions a day? So if you were to say, out of those 35, Brianna, or the 60 for Holly, roughly speaking, what sort of a number would you think of with things that you would fall into this kind of a category of just do it solutions in a day? About 2/3? Yeah, that makes sense. Yeah, when you start looking at individual specific point issues like that, usually between half and 2/3 or so is about where people are in terms of just do it. And again, that's usually enough to resolve the issue, keep going, and you're not really devoting a massive amount of time to it. It's just solving the problem and getting on with whatever you need to do. Of course, that still leaves the extra third, which we'll talk about when we start getting into some more of the advanced techniques. But again, you're looking at this individual simple method of just do it troubleshooting. The key to this one is that it solves the point issue. It doesn't necessarily solve the root causes. It fixes symptoms that are causing the difficulty right at the minute, but the underlying root causes aren't necessarily fixed. So, that's perfectly okay for some issues, but when you start getting into some more complicated things, quite often that's not the case. These are what we call gap from standard problems. And in the book that I just described with Art Smalley's, they actually categorize a couple of types of gap from standard. And one of which is just straight troubleshooting, and the other one is when you start talking about basic structured problem solving. So the question to be asking when you're thinking about gap from standard is, what issue are we trying to solve, and what are we trying to accomplish? What change are we going to make to the existing system, and how will we know that the change is an improvement? It's all fairly basic stuff, but once you start getting into the nuts and bolts of PDSA, you realize that a lot of it is quite basic, but it's got an underpinning of scientific method that we'll talk about in a second. So if you're thinking about anything that's not a specific troubleshooting incident that we were talking about before, and you start thinking about something that is a slightly deeper problem that you've got to solve, these questions are going to come up. What issue are we trying to solve? Turns out that isn't as easy as it can be perceived initially. What issue we were trying to solve can actually be buried in several different layers when you start to look at things to be resolved permanently. What are we trying to accomplish? Again, is a similar issue that's tied in very very directly with what issue we were trying to solve. The changes that you're going to make, obviously, you have to think those through depending on what you're trying to achieve, and how if the change is an improvement starts to get directly into the concept of measurement. And again, that's something that when you start looking at PDSA as a structure, the measurement component of it becomes something that is more significant as you get deeper into it. So we'll talk about that in a second. So the PDSA method, and again, we start looking back in history, and it was designed originally as a cycle with the plan, do, study, and act. And that's what this little graphic's all about. It's you start off with a plan, you do it, you study the results, and you act upon those results, or adjust and work on the cycle again to feed it back into a new plan. Or you can even adopt the methods that you've just devised in the PDSA cycle. So plan, do, study, act is really the cycle, and the idea is that it evolves to a point where you're happy with the results. So you're planning an experiment. You're looking at an initial condition, and then you're planning an experiment to change that. Then you're running that experiment by doing. and studying the effects of that experiment on that variable that you're studying, whatever that may be, and then acting or adjusting, refining it or adjust the experiment and run it again. That's the overview of what PDSA looks like. It's really meant to be something relatively simple, relatively quick, but it's structured enough that it sends you through a specific thought process. And that's really one of the things I wanted to leave you with today. It was that PDSA is the start of a change in thinking. It's not necessarily something that you follow rote by rote or piece by piece, although we do have templates for that. And I'll show you one of those in a second. It's more about a change in thinking, about thinking through things in a somewhat scientific method. So if you remember, one of the first questions we talked about was, what issue were we trying to solve? Well, in the world of problem solving, and more specifically the world of things like Lean and the Toyota production system, there's this phrase that we always use called grasp the situation. And what that really means is have a good understanding of the current situation around the issue that you're trying to resolve. And that can mean all sorts of different directions. It can mean gathering numerical data. It can mean looking at the overall layout of a particular facility or waiting room or exam room. It can be looking at things like the scheduling system and figuring out whether patients need to be at specific points or whether you're allocating enough time for a patient in the schedule. It can be looking at things like provider schedules, any of those kind of things. The combination of that is going to be unique to each individual problem. So understanding what all of that looks like and how what you're trying to solve impacts it is some good basic pre-work that you need to do to be able to grasp the situation around that issue. And as a part of that, you're going to be identifying issues, not least of which would be the one that brought you to it. It's quite common, though, for that to be able to spill out other issues that affect or are compounded with the issue that brought you to it in the first place, and being able to pull those composite issues is actually quite a useful skill when you start getting into PDSA. Ideally, though, when you're looking at resolving a problem with PDSA, you're trying to isolate one particular variable, and it's not an absolute. You know, there are problems that you can have multiple variables there that will be fine with PDSA. But generally, it helps to think it through if you've got something that you can vary one parameter with. For instance, things like, just off the top of my head, let's say you were going to be improving the no-show rate for a particular clinic in the hospital. You start off collecting some data, you find out that the initial no-show rate's 15%. So 15% of all of the appointments that are made, people don't show up for. And then you start looking at, okay, well, what could be the root causes for that? Start thinking about things like, is the communication in the right way? Do they actually understand that there's an appointment been made for them at that point? Is there a notification system? You know, is there like a text, a pre-message or a calendar pre-message or even a phone call to those patients to be able to get them to that appointment on time? Are there socioeconomic factors and social determinants factors that are causing difficulties there? Things like transportation or finances or even drug-related issues, whatever it may be. So you start looking at all of those different facets, and that may or may not work with one PDSA. You may end up looking at multiple different issues, all of which may have their own individual PDSA. But the process of understanding all of that and analyzing it to be able to get to that point is usually quite revealing. And the idea is that whichever one that you're going to look at, whether it's multiple ones or one, you're trying to create a problem statement, something that describes succinctly what you're trying to solve, so that then you can feed that into the PDSA process. So it works well with things like single factor issues, clear definitions, quick and simple issues. I realize that all of these are largely not so much arbitrary, but certainly they're more descriptive. So I've put a couple of examples up here, things like improving referral uptake rates, improving no-show rates that I just talked about, improving medication reconciliation rates, even more specifically, things like improving surgical cart preparation accuracy. You can work on quite a few of these with just the PDSA method and achieve some good results for them. Each one of these I've done work with in the past on many occasions. I mentioned that PDSA is basically the scientific method. And because of that, it's an adaptation of what happens during the scientific method. And the basics of that are you're observing a specific situation. This is what we talked about when we were talking about the grasping the situation component. You're observing a specific set of conditions and certain actions that are happening. And because of that, you're trying to work out what is going on there. So you're creating a hypothesis. To get back to our no-show rate, the hypothesis could be we're getting 15% no-shows because patients are living further away from the hospital, and the transportation systems don't allow them to get there on time. And then from that hypothesis, then you're starting to talk about how do you perform an experiment changing something so that you can see if it's an improvement or not. And from an experimentation standpoint, that could be something like work with the local bus company to be able to lay on a specific bus route, or pay for people's cabs to be able to get there, those kind of things. And once you've run that over a specific period of time and with a certain number of replicates, then you can look at the results and analyze them. And based on those, you'll be figuring out whether the original hypothesis was correct, and whether that change is something that you want to change the original process with, or if it means that you're not quite on the right path and you need to reformulate that hypothesis to be able to solve that issue. So as you can see, it steps you through scientific method, but it does it in a quite a prescriptive way, and actually quite simply when you look at PDSA. So the question then is, where do you begin? Well, let's start and figure out if the issue is defined to start off with. This is what we were talking about 3 slides ago when we were saying about defining that issue, really understanding it, grasping the situation by gathering data. Do you have it down to a simple problem, like ideally with one variable? So you're going to formulate a hypothesis, and then you're going to work through the plan, do, study, act cycle. So you're going to plan how to test that hypothesis, then you're going to actually run the experiment and do it. You're going to study the results and then act on those results afterwards. But the important part is the upfront component to it. I've seen many examples of really bright, really smart people diving into problem resolution and solving, and midway through they're having to backtrack when they understand that they're actually working on a multiple complex problem that really is going to be extremely difficult to solve using a PDSA framework. It's worthwhile doing the work up front just to define that, so that you know that you're using the right tool for it. So when I talk about gathering data and establishing a baseline, that could be multiple different sets of data. It can be descriptive, it can be mathematical, it can be numbers, it can be diagrams, it can be all sorts of different pieces of data, and the combination of that is unique and relevant to the specific issue that you're talking about. So figuring out the data collection plan is a component of your PDSA and part of the planning process. You're not just talking about testing a hypothesis, you're talking about actually changing a process temporarily and being able to measure it. And the act of measurement implies that you've measured a baseline. So again, a really common error that I find is that folks will dive off into an improvement project and they won't have even measured a baseline performance. So when they do get to a point of actually running the experiment and they've got results coming in, they've got nothing to compare it to. Again, it's basic scientific method, but it's something that is really worthwhile, not just understanding, but getting into the habit of. So definitely figure out what data that you need and establish a baseline for it. And then formulate your hypothesis. And a hypothesis is really a fancy word for a guess. You know, you're talking about if we did this, we would expect this. In this particular instance, we're talking about if we increase the number of follow-up calls from 50 to 100 per week, we'd expect an increase in appointments booked from 10 to 20 plus. That's your hypothesis, right, at that point. So the question then becomes, is that actually going to be true? And that's what would form the basis of the issue of the PDSA. You have to excuse my little rotary dial phone there. That belies my age, but what can you say? What can you do? It's much more difficult to draw a cell phone and have it look like it's ringing rather than one of those. So let's take a look at a template and a method of working with it. So we're planning out a small test of change, and we're running it for a few days. You know, don't want to change the entire system all at once. We're supposed to be a small test. And the idea is you're going to be using a subset of the population that you're working with, or some other variable, something that makes it nice and easy, that you're not going to be working with thousands of different data points. You're just going to be doing a small test, but something that will represent the right impact, and it'll be able to demonstrate the fact that something's actually happening. Again, that's going to depend entirely on the circumstances that you've got. You're going to be defining things like what's going to happen, where's it going to happen, who's going to perform it. And as I mentioned before, planning that data gathering and analysis is really an important component to this. I always find it useful to use a template, and I've got a Word template that I've done some screenshots for, and this is part of it. So this model for improvement template that I've got is, well, again, we talk about it being cyclical, so we're trying to indicate what cycle it's on, what the objective is for the cycle, and then start to look at the plan component. You know, what questions are you asking, what predictions are you making, what's the test that you're going to be working with, what's the plan for it, and how are you going to collect that data. This is all, you can see there's an awful lot of work underneath the plan section for the template. Do is talking about executing that planned test of change. And this is the next section on the template: carry out the change or test, collect data, and analyze. So you're going to collect the data according to the data collection plan that you planned out in the plan stage, and begin the analysis of that. And by that, I mean just looking at the overall data and seeing if there's any major obvious implications from the data itself without starting to get into statistics or anything like that. Quite often, when you're looking at doing one of these things in real time, having that ability to be able to spot anomalies and differences in the data without getting into the actual analytical components of it can be a really useful skill. And you can develop it over time, but it's one of these things that that happens with repetition and practice. And you're going to try and record the summary on the template itself. So that's all part of the do component. And for studying, you're going to complete that analysis of experimental data and draw the conclusions and summarize that learning. Analysis can be all sorts of different methods, anything from basic descriptive statistics, Pareto analysis. It can utilize all sorts of different tools like Ishikawa diagrams. You might be able to get involved in things like analysis of variance or t-tests, any of these kind of things that make sense depending on the variable that you're looking for. But having all of that isolated up front to be able to, when you've planned all of that, makes this phase immeasurably easier. So thinking all of that through so you understand what you're going to do at this point is a really positive benefit. And again, you're recording it on the template, and I'll show you the overall layout of the template in a second. I've just broken each section out here. And the last stage is acting or adjusting. So if the results after the analysis show the expected improvement, and we make a decision that that is something that we want to change permanently in the main workflow, it's time to plan for that full-scale change and execute it. But if they're not, and if there's some more work to do, it indicates the fact that we need to adjust that test to change and execute another cycle. So again, PDSA is cyclical. The idea would be that you would adjust the hypothesis, you would adjust the plan that you were going to test that hypothesis with, and you'd execute another cycle. And again, you'd record this on the template. The idea is that for each one of these cycles, you'd end up with one sheet of paper to be able to record all of these issues that you worked through. Here's the top section of that PDSA template, and as you can see, it's fairly simple. It's just got the title block up here, plan, do, and the second part of this is the study and act or adjust section. So very simple, but having this written down, I found is immeasurable value, because once you start using this and you end up with multiple ones of these ongoing, it's very easy to lose track. So being a little bit systematic about this, maybe running a 3-ring binder, whatever it may be, that has these things in there, is going to be valuable when you start getting into looking at multiple PDSAs, multiple improvement projects, and trying, more to the point, figuring out how they all compound to improve an overall workflow, an overall department, whatever it may be that you're working on. So the template's worthwhile doing, and I definitely recommend that. Absolutely, Brianna, and I will gladly send you this template. More than happy to. If you want it as a Word or a PDF, I can send you both of those. We're all about sharing and making sure that everybody's got whatever tools that they need to here. So we're very happy to send that to you. So the screenshots are good, but I should have mentioned that at the start. I'm more than happy to send it. So pitfalls. First one, and hopefully by now, if there's one message that you've got over, it's that you've got to plan this effectively. And the first part of planning it is actually identifying what you want to work on. It's easy to wing it, and sometimes you get away with that, and that's fine. Smart people can and do cut corners. I've seen it many times. I see it almost daily. People have all the excuses under the sun. There's too much going on to spend time planning this thing. But what I can tell you from bitter experience is that once you get good at this, the time that you spend planning it is minuscule compared to the time that you would spend running a poorly designed experiment, figuring that out midway through, having to go back and redesign it, all the time that you wasted running it. All of these kind of things are far in excess of the small amount of time that you would put into planning it effectively. That's why on that template, there's all of that work on the plan section. Second big one is not gathering baseline data. It's very common. When you look at it scientifically, it's amazing that people do it, but it's amazing really how many times people do that. And it's not anything that's malicious. It's not anything that's incompetence. It's not anything like that. What it is that folks, especially in the healthcare environment, want to go and just get the thing done. And something as simple and as necessary as understanding what the current system conditions are and how it's performing sometimes can get swept under the carpet. So it's very common. What I would recommend is that for each time that you do a PDSA, at least ask the question, how are we going to measure this? How are we going to know it's an improvement? That then naturally leads you to thinking about, well, we need a baseline. So not gathering baseline data is a big pitfall. The third big one is not involving appropriate people. PDSAs are, by their definition, are a change management tool. And change management can operate at multiple different levels within an organization, and especially in a hospital. Depending on the culture of the hospital and the various organizational constructs around it, you generally need a representative team of people to be able to design a PDSA, because a workflow, unless it's in a very specific point, tends to cross over functional boundaries. So having representatives of that team to be able to help with the PDSA is usually a pretty good thing. And also having sponsorship from a senior management level can usually be advantageous also. It really depends a lot on the magnitude of what you're trying to do, and also, again, the culture and of the organization. If you're in an organization where the culture is, well, yeah, just try it, but don't spend anything, then yeah, there's still plenty that you can do with a PDSA cycle. When you start getting into things like, well, yeah, we're going to change this, and because of the changes in workflow, we're going to need an EMR upgrade. Absolutely, you're probably going to need approval from finance or from the CMO or the CEO or whoever it may be. So think that through to start off with. And again, that's something that is going to be totally unique to each individual situation. But involving the appropriate people is a really critical component. So where it makes sense to start this if you're just starting off on the PDSA pathway? Well, a lot really depends on your experience and ability in improvement science. If you're just starting out on this and you want to try it, start up on your own or in a small group in your spare time with an individual department that you're related to. As you talked about earlier, whether it's 60 or 35 issues per day, there's usually plenty of these things that you can test this out on for your own benefit. And you can do it with almost no resources utilized, tiny little bit of time. But again, you think of it in terms of making improvements and building a capability. If you've had some experience and ability in improvement science, start looking at the overall patient care value stream. When patients present, and whether they come in through the ED route or whether they're coming out through electives or whatever it may be, what happens to those patients, and starting to figure out what that looks like in terms of the value stream of that patient as it goes through, as the patient goes through the hospital itself. That value stream will give you the context for each of these individual issues. So understanding that and being able to put all that in context is usually at this level. If you're totally familiar with all of this, go the whole hog. Have a look at the patient care value stream with all of the ancillary streams involved. Things like lab tests and diagnostic imaging. And if you can muster resources, have some dedicated time and several small groups. I find that it really helps to have an external pair of eyes, especially when you're starting this out. So we do recommend an improvement coach, and full disclosure, we are improvement coaches. So that's obvious that we're going to recommend that, but we do see that as being something that is a significant success factor when people are starting out on this. So what I would recommend is start improving. Take the time to start off with to quantify that capacity and waste. And what I would suggest for your 35 issues, Brianna, as a start, is one day just make a list of them. Make a list of them to figure out what they actually are, and start to have some kind of a thought process around, okay, well, how do I actually solve these? Quite often that requires you taking a step outside of yourself to actually observe what you're doing. And if you're doing it day in, day out, quite often it's just automatic. But just taking that little step back so that you can take an external viewpoint to it usually reveals some quite interesting things. Measure often, and the act of knowing that you've got to measure means that you've got to have something to measure. It sounds obvious, but again, these things are things that are missed at the start and then compound. So figuring that out at the start is really important. And utilize the PDSA framework. You've got the template, and I'll send you that template so that you've got it. And being able to think through those components it'll lead you to more success than failure, for sure. So definitely utilize the template. Once you've started to look at these, you'll find that there's repetitive problems, and they may be repetitive within your own area, and they may be repetitive across different functional areas within the hospital. So be on the lookout for that and start to communicate with folks. Change management at its most fundamental is all about communication. I have a rule of thumb that if you're communicating more than 3 times what you think that you should be, that you're comfortable doing, you're about right. It almost gets to the point of evangelism, but own that. Be the evangelist. If you can look at a structured method of solving problems, and you can start to build up a history and a portfolio of these things that are demonstrably better, people will start to listen. And so being that evangelist has got teeth behind it at that point. And the last point is one that I revealed earlier on. Get sponsorship for it. If there's something that is going to be significant change, you're going to need that sponsorship from the upper levels to be able to ostensibly give you the authority for it, but for many other different reasons also. So those would be my recommendations. And all that being said, is there any other questions that have come up that anybody would like to chat about while we have everybody on the line? I'll give everybody about 30 seconds or so to think about that. You're very, very welcome, Brianna. Thank you so much for attending. We really appreciate it. And we'll be following up, obviously. So Holly will be in touch with you regarding, well, initially there's always a survey with these things. Yeah, please think about ways that we may be able to help, and we're more than happy to do that. All that being said, I'm going to close this up for today. Thank you again for being here. The recording of this is going to be available on our YouTube channel that, again, Holly will be sending out the details of. Have a great rest of the day, and happy PDSAing. We will talk to you soon.